Among young people in this country. The numbers tell part of the story. For example, medical care for victims of violence now costs this country up to $18 billion a year. In New York City alone, it costs more than $9,600 to treat every gunshot victim. Last year, the city had almost 6,000 of them. Of course, the cost of youth violence is not just measured in dollars. In many cases, victims pay the highest price, something that we've seen in all four cities that we've been looking at this week. Tonight, San Francisco, the view from the emergency room. NBC's Margaret Larson.
San Francisco General Hospital.
Tell me that one of these stab wounds went into his chest and partially collapsed his lung down.
19-year-old Davis Avilar was stabbed repeatedly near the heart with a screwdriver.
Pressure's coming down.
Dr. Gino Tellez, a trauma surgeon, is battling to keep Avilar alive. It's a scene played out daily in the city's Mission District, where gang violence is an entrenched way of life.
We get angry, we get mad. We go and kill one of them, and they kill one of us, and this won't stop.
In the first 6 months of this year, 15 juveniles have been arrested in murder cases here, just one arrest short of the total for all of 1992.
Put your hands on your head. Lock your fingers together.
There are more and more kids getting arrested, more and more of you getting killed, more and more of you killing each other. Where does that stop?
It doesn't stop.
Nationwide, violence is the leading cause of death and disability for people 15 to 34 years old. On the basis of those figures, violence among young people is being considered now a public health issue, and it's being called an epidemic.
I think if nothing is done, it'll just keep escalating, and eventually we'll definitely just destroy ourselves.
So Dr. Tellez is exploring a different approach, treating violence not just as a crime, but as a preventable disease. He says public health education can make a difference, similar to the attack on smoking, drunk driving, or even AIDS.
I think we need to get involved and get out there, because we should really be the vanguard as physicians.
Funded with a small part of a $30 million grant from the nonprofit California Wellness Foundation, Dr. Tellez recruits other physicians for community outreach programs. He also spends time in the Mission District, sharing information with social service experts and developing a support network for young violence victims after they've left the hospital.
My concern is just following these kids and to find out where they're going and where they're headed.
Two gangs in a world of violence.
He also wants children to know that violence on the streets isn't Hollywood make-believe.
It does hurt, and you do not get up off the street and walk away. And they're very surprised about how much it hurts. They're extremely unaware of how bad it really is.
Dr. Tellez and his colleagues see the worst of it, and that's moving many health workers toward activism and a demand for health care reform to include violence prevention programs.
They don't like treating a little 4-year-old that's been shot in the stomach with 5 9mm bullets. And when you get that kind of a perspective outside of the hospital into the policy arena, that has force.
But they all realize it's an uphill battle.
Now we have something else coming in.
As Gino Tellez scrubs for surgery on one victim, more arrive downstairs.
And it keeps on rolling.
Tellez believes the medical community can offer some solutions in the war on violence, but he also knows it's a war that so far we are losing. For America Close Up, Margaret Larson, NBC News, San Francisco.
It's not